We're going to finish up today looking at a whole bunch of different classes of drugs. So, by the end of this, you guys are going to be able to explain all the major actions and the effects of the different classes used to treat infectious diseases and cite the primary uses for antibiotics, antitubercular, antifungal, and antiviral agents. Our first class of drugs are aminoglycosides. These work by inhibiting protein synthesis, and they're used against gram negative organisms that cause urinary infections, meningitis, wound infections, and septicemia. Some severe adverse effects you can see with aminoglycosides are ototoxicity and nephrotoxicity. And it's really important not to give these within 72 hours of skeletal muscle relaxants used with anesthesia because they can cause respiratory depression and other issues like that. And you're going to see that side effect come up fairly frequently with antibiotics. Next, we have carbapenems. Carbapenems work by inhibiting bacterial cell wall synthesis. So they're potent, broad spectrum agents that are resistant to beta lactamase enzymes that are secreted by bacteria. They're used to treat severe infections by multi drug resistant organisms. They have some pretty serious adverse effects, though. Hypersensitivity, severe diarrhea, especially if it contains blood, it could be an indication of pseudomembranous colitis. Dizziness, confusion, and seizures can all happen with these drugs. So, under what conditions then do we use these carbapenems? And there are several different situations where we would use them. They're commonly used for lower respiratory tract infections, intra-abdominal infections, urinary tract infections, and including pyelonephritis, which is infection of the kidneys. They're used for bone infections, joint infections, skin infections, gynecologic and acute pelvic infections, endocarditis, bacterial septicemia, severe infections caused by multi resistant organisms, bacterial meningitis, and also for pneumonia. Our next drug class are cephalosporins. Now, cephalosporins are related to penicillins. What they do is they inhibit bacterial cell wall synthesis, and they are divided into different groups. So, we use them for different things. We use them to treat urinary tract infections, respiratory tract infections, abdominal infections, bacteremia, meningitis, osteomyelitis, and ceftaroline also may treat MRSA or VRSA. Some common adverse effects you'll see are diarrhea and electrolyte imbalances from these, and they can also cause some more serious effects like secondary infections, hepatotoxicity, nephrotoxicity, and hypoprothrombonemia as well. Glycopeptides are another class of antibiotics. They work by preventing the synthesis of bacterial cell walls. We use glycopeptides such as dalbavancin is used in the treatment of adult patients with acute bacterial skin and skin structure infections. Some other examples are irradavancin, telavancin, and vancomycin is probably the one you've heard of most commonly. They do have some pretty serious adverse effects, though. Ototoxicity can happen, nephrotoxicity, they can prolong the QT interval, coagulation can be affected, hepatic effects can happen, and secondary infections can also occur. Vancomycin can be a pretty severe vesicant, so we have to be careful in monitoring our IVs. And this is also a medication where we might commonly be measuring troughs and peaks of the blood levels of this particular drug. Our next drug class is glycylcycline. A common drug in this class is tigacycline or Tigacyl. This works by binding to 30S ribosome, preventing protein synthesis. It's also a bacteriostatic. So it's used in treating broad spectrum gram positive, gram negative, and anaerobic infections. It does work against MRSA as well. So, like a lot of these, a common adverse effect for these drugs are gastric irritation. It can also cause some severe effects with severe diarrhea or photosensitivity. Let's look at our next drug class, the macrolides. How do these work? They work by inhibiting protein synthesis. They're a bacteriostatic and a bactericidal. The difference between those is bacteriostatic means It helps to prevent them from proliferating anymore, where bactericidal means it actually kills the bacteria. Macrolides are used to treat respiratory infections, GI tract, skin, as well as soft tissue infections. And our therapeutic outcome, as with most of these, is we want to see the elimination of the bacterial infection. Some common adverse effects, again, include gastric irritation. Some severe adverse effects you might see are that severe diarrhea we keep seeing pop up, as well as thrombophlebitis can happen. Some common drug interactions you might see with these drugs are toxicity that's caused by the inhibition of metabolism of some other drugs like benzodiazepines and buspirone. So macrolides can inhibit the metabolism of those drugs and have them build up toxicity in the body. Do not administer macrolides with pomazide. Death has resulted from this combination. Co-administration of macrolides with rifampin or rifabutin can reduce the antimicrobial effect and increase GI adverse effects. So don't use them together. It will increase all the wrong things and decrease all the things you don't want to happen. And also, these drugs can interfere with the activity of oral contraceptives. So other contraceptive methods should be used in addition to the oral contraceptives while taking these medications. Our next class is oxazolidinones. A drug in this class is linezolid or Zyvox. This works by inhibiting protein synthesis in the bacterial cells. This is also a bactericidal and a bacteriostatic. It's used to treat serious or life-threatening infections that are caused by gram-positive organisms. More common adverse effects like we've seen are that gastric irritation that keeps popping up. It can also cause headaches. Some serious adverse effects of these drugs are severe diarrhea, bone marrow suppression, secondary infections, lactic acidosis, seizures, or visual neuropathy. This brings us to our penicillins. These are kind of the original antibiotics, the things that you think of when you think of antibiotics. Penicillins work by inhibiting cell wall synthesis. Then there's penicillinase resistant penicillins, and these are penicillins that fight back against bacterial resistance that some bacteria have developed to these penicillins over the years. They can be used to treat middle ear infections, pneumonia, meningitis, urinary tract infections, syphilis, and gonorrhea. Some of the normal common adverse effects include diarrhea and electrolyte imbalance, but they can also have some of the normal serious adverse effects, hepatotoxicity, nephrotoxicity. They can also cause hyperkalemia or hypernatremia. Quinolones are another class of antibiotics, and one subclass of this medication are known as fluoroquinolones, and these inhibit activity of DNA gyrase, which is an enzyme needed for the replication of bacteria. So these antibiotics are effective against both gram-positive and gram-negative bacteria. They have some common adverse effects that include nausea, vomiting, diarrhea. They can cause some discomfort, some dizziness, and some lightheadedness. We also have to watch for serious adverse effects like photosensitivity, a rash, nephrotoxicity, neurologic effects, and hepatotoxicity. Some things to keep in mind with quinolones. They absolutely should not be prescribed for patients younger than 18 years of age. Doing so has resulted in increased incidence of musculoskeletal disorders for those patients. This risk of musculoskeletal disorders also goes up in patients older than 60 that are using corticosteroids. So we need to avoid extremes in either end of the age spectrum. Animal studies have also demonstrated teratogenic effects of quinolones, or effects that cause birth defects on fetuses. So this drug also should not go to pregnant women. Levofloxacin should be used with caution in older patients with long QT syndrome, patients with hypokalemia, or taking certain antiarrhythmic medications as well. Streptogrammins, such as quinipristin, dalfapristin, or cinarcid, they work by inhibiting protein synthesis in bacterial cells. We use them for the treatment of vancomycin-resistant E. faucium, VRE, as also for MRSA. They have some common adverse effects like pain, inflammation at the infusion site, nausea, vomiting, anorexia, abdominal cramps, diarrhea. They also can cause some severe adverse effects with hepatotoxicity, arthralgia, and myalgia. They have numerous serious drug interactions as well. They can cause toxicity by reducing the metabolism of many drugs like statins and lidocaine. So these really have to be used with caution. Sulfonamides are a class of antibiotics that you're going to come across pretty frequently. And they work by inhibiting the bacterial biosynthesis of folic acid, which then results in the cell death of the bacteria. We use them for treating UTIs, otitis media, which are ear infections, traveler's diarrhea, chronic diarrhea, and they're also good for the prevention and treatment of pneumocystis jirovecii in immunocompromised patients. Some common adverse effects we see, though, are nausea, vomiting, anorexia, and diarrhea. The serious adverse effects to watch for in sulfonamides are rash, pruritus, photosensitivity, hematologic reactions, and neurologic CNS effects. If a patient starts to develop rash or pruritus, we need to notify the provider immediately. And also, we sometimes can see a crystal formation in the urinary tract if the patient is dehydrated. So we have to make sure they're adequately hydrated with these drugs as well. Tetracyclines inhibit protein synthesis by bacterial cells, and we use them to treat STIs, UTIs, upper respiratory tract infections, pneumonia, and also meningitis when penicillin is contraindicated for it. Some common adverse effects are nausea, vomiting, anorexia, abdominal cramps, and diarrhea, but they also can cause the serious adverse effect of photosensitivity. Okay, lots of information, lots of different drugs. So let's take a second and step back. Let's test our knowledge a little bit. Here's a question. A nurse is seeing a 20-year-old female patient for a case of severe acne, and she mentions that she is taking a prescribed tetracycline antibiotic. Which statement indicates that the patient is in need of more education? A. I make sure I take my tetracycline between meals. B. My boyfriend and I don't usually use protection when having sex. C. I always wear sunscreen outdoors and I don't stay in the direct sun too long. Or D. I was a little nauseated when I started the medication, but now I feel fine. If you answered B, you're correct. A, the patient does not need more education. She is correct in saying that she needs to take the tetracycline between meals. It needs to be taken on an empty stomach in order for it to have maximum effect. C is correct. Tetracycline can cause photosensitivity, so she needs to be cautious how she behaves in the sun, using sunscreen, staying covered up. D is also correct. It's common to feel nauseated, but often these effects will go away on their own after some time. So B is incorrect. The patient needs more education. First, she should be having education in general to always use protection when she's having sex with her boyfriend, unless she's trying to get pregnant. And B, this antibiotic can increase the risk of getting pregnant even on oral contraceptives because it decreases the effectivity of oral contraceptives. So the patient should be combining other methods of protection with her oral contraceptives in order to maximize protection while she's taking this antibiotic. Let's talk now about antitubercular agents. The first one is the drug called ethambutol or myambutol. This works by altering the cellular RNA synthesis and phosphate metabolism. It treats tuberculosis, but it has common adverse effects including nausea, vomiting, anorexia, and abdominal cramps. Some serious adverse effects that can happen with this drug are confusion, hallucination, blurred vision, and red-green vision changes as well. The next antitubercular drug is called isoniazid or INH or nidrazid. This works by disrupting the cell wall and inhibiting the replication of tuberculosis bacteria. So it treats and prevents tuberculosis, but like all these other drugs, it has some adverse effects like nausea and vomiting, and some more serious effects including hepatotoxicity, tingling, numbness of the hands and feet, dizziness, or ataxia. Pyrazinamide or Tebrazid is the next antitubercular agent. This works by lowering the pH of the environment. So it treats tuberculosis that way, and it works in combination with other antitubercular agents. Common adverse effects of this one include nausea, vomiting, anorexia, arthralgia, and myalgia. And we need to look for the serious adverse effect of hepatotoxicity. Our next and last anti TB drug is rifampin or rifatin. This works by preventing RNA synthesis by inhibiting DNA dependent RNA polymerase. It eliminates meningococci and H. influenzae type B, Hib, from asymptomatic carriers. Some common adverse effects to look for with this one are reddish orange secretions. So we're talking from tear ducts, we're talking sweat, urine. It can even stain contact lenses because of this discoloration. Then there's serious adverse effects that include nausea, vomiting, anorexia, and abdominal cramps. Okay, so what important information does a nurse provide to a patient prescribed rifampin or rifatin to treat tuberculosis? A, medication should be taken with food to reduce irritation to the stomach. B, oral contraceptives are not affected by the drug. C, this medication will turn body secretions a reddish orange color. Or D, any nausea and vomiting must be reported to your healthcare provider immediately. And the answer, of course, is C. This medication will turn body secretions a reddish orange color. A is not correct because this medication does not necessarily need to be taken with food. Oral contraceptives certainly are affected by this drug, and again, extra contraceptives should be used on top of those while taking this drug in order to maintain contraceptive effect. And nausea and vomiting can happen with this drug. It does not necessarily need to be reported to the provider immediately. It will frequently go away on its own. So now we have some miscellaneous antibiotics left to look at. There's aztreonam, which is azactam. This inhibits cell wall synthesis, like monobactams. There's clindamycin or cleocin, which inhibits protein synthesis. And then there's daptomycin or cubicin. Now, these are cyclic lipopeptide, and it binds to bacterial membranes and causes rapid depolarization, leading to cell death. But some serious adverse effects here include diarrhea and muscle pain. So we do have to watch that, particularly watch for the muscle pain with these drugs. Our other miscellaneous antibiotics include metronidazole or flagyl, which is bactericidal, trichomonicidal, and protozoicidal. So it will kill lots of different types of organisms. You'll see this one used a lot. Then there's tinidazole or Tindamax. This one is similar to metronidazole. The primary therapeutic outcome here is the elimination of parasitic infection. So, which of these medications we just learned about is in a class of antibiotics known as cyclic lipopeptide antibiotics? Is it A, metronidazole or flagyl, B, clindamycin or cleocin, C, chloramphenicol or chloromycetin, or D, daptomycin, cubicin? And the answer is D. Daptomycin is the drug that fits in that category called cyclic lipopeptide antibiotics. Let's move on now to some topical antifungal agents. These work by altering the permeability of cell membranes, and they cause amino acids and electrolytes to leak out. They treat things like tinea pedis, tinea cruris, tinea corporis, tinea versicolor, and candida infections. Common and serious adverse effects include irritation, redness, swelling, blistering, and some oozing. And you need to be careful with how you apply it. Topically, you need to make sure you're using clean gloves, washing your hands before and after, and that way you're not spreading it around from spot to spot or to other patients or yourself. You also need to make sure you're keeping the area well ventilated. Cotton socks, cotton clothing, let things air out as much as possible. Then for intravaginal application, make sure the applicator is washed with soap and water between uses. And every prescribed dose needs to be used even if the symptoms disappear so that we don't promote resistance to the drugs. Less common than those skin fungal infections are systemic fungal infections. But when these systemic fungal infections happen, they can be serious. So we do have some systemic antifungal agents we can use. The first one is called amphotericin B, and this is a fungostatic agent. It disrupts cell membranes of fungal cells. So this treatment is for systemic life-threatening fungal infection. That's where you're going to see it. Common adverse effects from this drug include malaise, fever, chills, headache, nausea, vomiting, and thrombophlebitis. Some serious adverse effects that can happen are nephrotoxicity and electrolyte imbalance. Another systemic agent used for antifungal properties is fluconazole or diflucan. This is chemically related to ketoconazole and itraconazole. It inhibits certain metabolic pathways in fungi, and that's how it works. So we use it to treat meningitis, candidiasis, and systemic candidiasis. Some common adverse effects include nausea, vomiting, diarrhea, and it can have some serious effects, including rash and hepatotoxicity. Our next systemic antifungal agent is glycofulvin microsize, also called glycofulvin ultramicrosize or glyfulvin V. It works by stopping cell division and new cell growth, so it's used particularly for treating ringworm. Some common adverse effects are nausea, vomiting, and abdominal cramping, but some serious effects you can see include urticaria, rash, pruritus, photosensitivity, confusion, dizziness. It can cause secondary infections, nephrotoxicity, hepatotoxicity, and also other hematologic issues. Itraconazole is the next systemic antifungal agent, and you'll notice a lot of these antifungal agents end in that segment azole, and you'll see that a lot. If you see something ending in azole, you can probably guess that it's an antifungal agent. So itraconazole or Sporanox, it's chemically related to fluconazole and ketoconazole. It interferes with cell wall synthesis is how it works. So we use it to treat a whole variety of infections like candidiasis, histoplasmosis, and blastomycosis. It can cause nausea and vomiting, and it can also cause some more serious effects like hepatotoxicity, heart failure, pruritus, and rash. And it has a number of serious drug interactions. It interacts with antacids, histamine 2 antagonists like famotidine, and also with phenytoin. And it decreases the effect, all those drugs decrease the effectiveness of itraconazole, making it not work as well. And then conversely, itraconazole causes toxicity with a bunch of other drugs like benzodiazepines and calcium channel blockers. So we have to be careful with those as well. Terbinafine or Lamisil is our last systemic antifungal agent we're going to look at today. It works by inhibiting squalene epoxidase, which is a key enzyme required for biosynthesis in fungi. It's used to treat onychomycosis of the toenail or the fingernail. And some serious adverse effects that can come with it are pruritus, rash, fever, chills, nephrotoxicity, hepatotoxicity, even neutropenia and lymphopenia. Okay, of those 5 drugs we just reviewed, which one of those antifungal agents is typically employed in the treatment of systemic, life threatening fungal infections? Is it amphotericin B, fungizone 4? Is it butenofine or Lotrimin? Is it ketoconazole or Nizoral? Or is it fluconazole, diflucan? And the answer is A, amphotericin B. That's the one we use when it's a life threatening systemic fungal situation. That's our drug of choice. Last but not least, let's talk about antiviral agents. Our first one is acyclovir or Zovirax. This works by inhibiting viral cell replication. Topically, it's used to treat herpes genitalis. Orally, it's used to treat recurrent genital herpes. IV, we use it to treat herpes simplex types 1 and 2 in immunosuppressed patients. Serious adverse effects of this one are pruritus, rash, burning, hives, diaphoresis, nephrotoxicity, hypotension, and confusion. You got to be cautious with topical use with these to avoid spread, like we talked about earlier with other drugs. Wear gloves for application and use proper hand hygiene to make sure it doesn't spread to areas where it shouldn't be. Famciclovir or Famvir is a prodrug of penciclovir. It inhibits viral cell replication. We use it to treat recurrent infections of genital herpes or acute herpes zoster. It can cause nausea, vomiting, or headache, and it can also cause some pretty severe effects of confusion. Oseltamivir or Tamiflu is probably what you've had prescribed to you if you've ever gotten medication for the flu. It works by inhibiting neuraminidase. It treats uncomplicated acute illness caused by the flu. And it needs to be prescribed and started to be taken within the first 48 hours of symptoms for it to have much effect. All it does is decrease the length of time of symptoms for about a day. It can also make the symptoms less severe. Some common adverse effects include nausea, vomiting, cough, sore throat, fever, or continuing of symptoms if perhaps we didn't start the treatment soon enough. Ribavirin, or Virazole, Ribitol, Ribosphere, is an antiviral drug that we don't even know how it works. We don't understand the mechanism of action, but we know that it works. So we use it in combination with interferon alpha 2b to treat chronic hepatitis C. It's also effective against DNA type viral families. Its inhibitory activity against RSV, influenza, and parainfluenza all make it very effective. It can cause rash, it can cause conjunctivitis. It also can have some more serious effects, such as diminishing pulmonary function or anemia. Now, this drug is given through respiration. So there's a special technique for mixing and administering the breathing treatment. You got to use a aseptic technique to prepare it. And then it's given aerosolized to patients for 12 to 18 hours a day for anywhere between 3 and 7 days. Valacyclovir or Valtrex inhibits viral cell replication. This is great for the treatment of acute herpes zoster, shingles, and also for herpes labialis, cold sores, and genital herpes. And we expect that it will eliminate the symptoms of viral infection in the patients we use it on. Our last antiviral drug is zanamivir or Relenza. This works by inhibiting neuraminidase, which is an enzyme on the viral cell coat that's necessary for replication. It's used for uncomplicated acute illness from flu, but it can have some serious adverse effects like asthma, bronchospasm, diminishing pulmonary function, cough, sore throat, fever, or symptoms can continue when still using this drug. Almost done. Let's apply this to a patient now. So, while making patient rounds, the nurse notices that a patient's right arm is swollen, red, and painful to the touch at the IV site. The nurse knows from the report that the patient needs an IV for a cefaclor or C-chlor infusion to treat her urinary tract infection. So, what should the nurse do in this situation? So, anytime we see that something is going wrong with an IV, we do need to take care of it promptly. In this situation, when the arm is getting swollen, red, and painful, that's a sign that there might be some infection starting to brew in that vein. So it's important here that that IV come out and a new IV be placed elsewhere. It's also helpful to take that arm and elevate it, and even to put cold compresses on the area because that can help with the inflammation at the site. So a new IV will need to be placed, and the swelling and infection needs to be addressed at the other IV site. The nurse would also need to keep assessing to make sure no signs of brewing infection continued and showed that the patient might need medication treatment for such infection. Awesome work today. Thanks for being flexible, everybody. I know it was a whole lot of material. So if you have any questions, please just let me know. I'm happy to answer them and try to make sure you understand all of this stuff. Okay, thanks, everybody.